Okay, here are my note cards. And my audience. Okay, so today I will be informing you on the rise of medical or behavioral medication on adolescents and why is it a cause of concern. Behavioral medication was debuted in the 1950s, and with its recent increase used on children, it has become more of a concern than viewed as a positive. With the increase of these specific medications, we have to learn to understand why more children are being diagnosed with disorders that require these medications and what can be done to reduce the usage of them. I'll be providing the information on what we use the behavioral medication for these children and what kind of precautions we need to look for before using them and deciding to provide them for these children. When it comes to children, it's normal for them to behave rambunctiously or have energetic, but to some parents or some teachers, it is more troublesome than good for the children themselves. So they look for ways to help treat these behaviors, and normally that is taking them to a doctor and having someone diagnose them with a behavioral disorder. A behavioral disorder in children is normally a behavior that is disruptive, that causes issues with their education, their situations at home, or even their social situations with their friends. And according to the CDC, between the years of 2016 and 2019, about 6 million children between the ages of 3 and 17 years were diagnosed with ADHD. Now, when it comes to psychiatrists and the physicians, when they diagnose these children and prescribe them the antipsychotic medications, they have to decide what severity they are at and what type of medication they will need. Many children do not typically need to be on medication because there are normally other forms of treatment they can do for these disorders, or if they do get prescribed medication, it's normally at a low dosage. And how do doctors normally determine what types of medication they need? According to the Journal of Early Childhood and Infant Psychology, psychiatrists and physicians receive a dramatically more diverse education with prescriptions and pre-service, and they have continuing education hours in the prescription of medication. And that was noted in 2009. If a parent doesn't want to have their child on medication, there are guidelines that providers have to take in order to determine if these children need to be on medication for these disorders. So normally they will do a behavioral therapy to determine, if the therapy is working, and if not, they will go into medications. And noted by Brown University Child and Adolescent Psychopharmacology, therefore the CDC had also made the note that fewer than 50% of children between the ages of 4 and 17 who are diagnosed with ADHD are not receiving the proper amount of behavioral therapy before being diagnosed. And that is more seen nowadays than it was a decade ago. And if these therapies are supposed to work, or if they would like them to work, parents are supposed to continue the therapy at home and continue that at school as well for a more permanent, long-term treatment of the disorder. But according to today's society, we look more for a quick fix rather than a long-term, healthier option for these disorders. So with the rise and the increase of behavioral medications these days on children, it is due to the fact that less children are getting the proper treatment for the disorder they're on, which could possibly help reduce the amount of children on antipsychotic medications. And we just need to learn to not have them prescribed on medication for behavior that is more likely natural than troublesome. Thank you for listening to my speech, and I hope you guys learned a lot about my issue about kids being on behavioral medication. Thank you. Okay, my audience and my note cards.